The Colorado report, about 61% of us adults, U.S. adults, will have cardiovascular disease by the year 2050. New research from the American Heart Association predicts.
Despite innovations in treatments, heart disease has been the leading killer of Americans for decades. In the research published today, the association predicts that 45 million adults will have some form of cardiovascular disease or will have a stroke in 2050. But there is one positive note. The number of people with high cholesterol is projected to decline, thanks in part to the sharp increase in the number of people who take drugs called statins, which can reduce the amount of cholesterol produced in the liver.
Our KRDO 13 medical expert, Dr. Neha Sharma, joins us live in studio with more on this COVID, actually the new research here, and to explain exactly what are statins and how do they work.
Statins are cholesterol-lowering drugs that can lower the bad cholesterol in our bloods by 60%. And they do so by decreasing the liver's production of cholesterol and also increasing its ability to remove it.
So statins have been around for a while, but there seems to be kind of a recent resurgence in interest for people taking statins as it relates to cardiovascular health. What do you attribute to that?
A fun fact is that statin is the most prescribed drug in the United States.
Wow.
About 40 million people currently take it. And there's been so much research around statins and cholesterol's effects on our bodies, so more data and evidence support the benefits of statin, which is why we're going to continue to see a rise in appropriate use.
And so what is the common on-label use for statins? Do people need a prescription for this as well?
It is a prescription-only drug, and there are only two uses. It's to lower cholesterol and to lower cardiovascular risk.
What sort of would be the symptoms that someone would prescribe it for? In other words, what side of conditions would you have to have in order to get it?
High cholesterol.
Okay.
And current recommendation is everybody between the ages of 40 and 75 with one or more risk factor for cardiovascular disease should be selectively offered a statin. Of course, always weigh your risk and benefit ratio. And common side effects are headache, dizziness, and muscle pains.
So in some cases, the risk might outweigh the benefit.
Yeah.
Are there cases where you might look at a patient and say, you know, you are eligible for this, but because of the risk, I'm going to refrain from prescribing it?
Correct, yes. So if they have any muscle issues or liver disease, sometimes kidney disease, the risk of statin is going to outweigh the benefit. Also, people over ages of 75, research shows that there's not much benefit of taking it if you don't need it.
Really? Wow. Very
Something to
interesting.
explore, a good resource for people that might be dealing with some of those conditions to kind of avoid heart attacks and strokes like we talked about.
Correct.
Dr. Sharma, thank you so much for joining us. Obviously, Dr. Sharma will be joining us every week, every Tuesday, in fact, to talk about some of the hottest healthcare topics out there. If you have any questions for Dr. Sharma or suggested topics to discuss, let us know. Email us at healthycolorado@krdo.com.